All right, everybody. Good morning. This is the February 11th, 2020 hearing for the City Council's Health Committee. I'm Councilman Christopher Burnett, Chairman of the committee. Also in attendance, we have Councilmember Henry representing the 4th District.
Thank you, Mr. Chair.
Councilmember Mary Pat Clark representing the 14th District. Nina Themlis from the Mayor's Office. We also are joined to my right by Margaret Curran, committee staff, and agency representatives from the Health Department, which will, as the presentations go on. Today's hearing pertains to obesity, nutrition, and health in Baltimore City. It is a part of our series of social determinants of health and exploring a variety of topics that are in public health related topics that are impacting the citizens of Baltimore. And again, as I say at every single one of these hearings, our intention is to explore these issues, produce a report at the end of the series, and build out a policy agenda from there, unless there are things that come up along the way that require immediate attention or intervention. The purpose of this hearing is to look at one of the major social determinants of health, which is obesity and access to quality food and appropriate nutrition. Obesity leads to chronic diseases and other diseases such as cancer and heart disease. Having access to healthy and quality food is one of the drivers to poor health, and not having access to healthy and quality food is one of the drivers to poor health in all of our communities, but especially so in low-income neighborhoods in Baltimore City. Today we will have presentations from the Health Department, representatives from Morgan State University, and the Black Yield Institute, and members of the public who sign up to say a few words. So with that, I'm going to hand it over to Jeff Ambrose. So I'm not sure where I'm going. Okay, you're doing okay. Yeah, go for it. I didn't know who was presenting. Sorry.
Wow, I am vertically challenged this morning. Good morning. My name is Kamala Green. I am the Director of Health Promotion and Disease Prevention here at the Baltimore City Health Department. We are excited and bring you greetings on behalf of the Health Department to discuss this morning obesity and nutrition in Baltimore City. And so we're going to go to the next slide, which will be what represents for us healthy food priority areas. The healthy food priority areas are what we designate what used to be called food deserts here in the city. And we classify them by the approximate distance from the location of a resident to an actual market, also social economic reasons, as well as if there is a lack of a market in that particular area. So I want you all to pay close attention to the map, because I'm going to refer back to this map as I talk about some of the programming around the city in reference to obesity and nutrition. So in 2010, the Baltimore Food Policy Initiative, which was a collaboration between the Baltimore City Health Department, Department of Planning, the Office of Sustainability, and the Baltimore Development Corporation, decided that they wanted to create health outcomes to increase access to healthy, affordable foods in Baltimore City's healthy food priority areas. And so through that initiative, we came up with some very innovative programming. So that goes to show you that for 10 years out, we have been doing some innovative programming around food access in the community. And that initiative really started, was called Balti Market, and that was really a suite of community-driven solutions to address food access and food justice through the virtual supermarket, healthy stores, and the Food Justice Forum. So all of this was really based on food insecurity, having food access, and then addressing systematic inequities when it comes to food. So oftentimes you all will hear residents say, I don't have a market in my neighborhood. Like, what are you all gonna do about that? Or the corner stores are not healthy. Or when am I gonna get healthy? Well, we're the ARABers. So that's where some of this comes from, is some of the concepts around some of the program that the health department gave us. So the next map we're gonna go to is where you have all of our 29 Baltimore City Health Department, our 13 virtual supermarket sites. So if you take a look at the map is still in, all of those sites are still in what we would call a healthy food priority area. They service our senior centers. There are 13 senior disabled housing sites. We serve over 1,100 unique customers in FY19. In FY19, we did 294 new customers. We did over 6,700 customer orders with a grand total of over $192,000 in sales through our virtual supermarket vendor, which is ShopRite. So we are using ShopRite at Liberty Heights, which has been assisting us with this program for some time. And so literally we use the seniors at those sites to assist us with deliveries and orders, and they are due a delivery once a week. The next thing is our Healthy Corner stores. And so again, I will encourage you to look back at the map, which is still most of our healthy stores are all located within the healthy food priority areas. And the purpose behind that is because we did respond to people asking for healthy foods. So in order for you to be considered a healthy store, you had to be able to had all of the ingredients, which would be around SNAP benefits. So you had to have dairy products, you had to have fruits and vegetables of some resemblance to that, whether it was frozen or fresh. You had to be able to sell water and 100% fruit juices. You also had to have grains and proteins at some level. So in order for us to consider you a healthy store, you also could not have any tobacco citations for selling to minors. So that's key to being a healthy store as well, because we looked at it from a holistic approach that if you're not selling to minors, you really are considered a healthy store. We have 300 stores in the city who have received information on becoming a healthy store, and 29 of them have agreed. We also, part of that is that they receive help in infrastructure and marketing. So we want them to literally put, instead of having Lucky Charms, we want you to have Cheerios at eye level and have the Lucky Charms either below or above because we feel like having marketing targeted at healthy marketing will prone to make the customer buy healthy. If I have sodas when I first come in the door, I'm not going to be prone to have water or 100% fruit juices. So we asked the store to also do a lot of moving around of their produce so that is the first thing that they will see when they walk into a healthy store. The other pieces that really helps us with healthy stores is doing nutrition education, and that is a key component to our city. We have found that by working in Baltimore City schools, kids might know that A is for apple, but they've never tasted an apple. So our key really is to introduce our young people and adults to healthy foods and to be able to make those things. But the real goal is to be able to go in a healthy store and make a complete healthy meal. So we don't want you using the carryout for a chicken box. We really want you to go in and use the things that make a complete healthy meal. So our new baby in the health department is nutrition ed, and I do say that it is new because we literally understood from all of these years of doing nutrition ed in our corner stores that we emphatically needed to be able to teach people how to use food, what is the impact of food on your body, and be able to plan, because people will often say, I don't have the money to purchase fruits and vegetables because of sustainability purposes. And so the goal really is to look at their budgets and to look at how you can prepare foods on a budget, what the impact of food is, and then to use our partners. So our partners, Hungry Harvest, University of Maryland Mobile Market, and the Maryland Food Bank are all partners that we use in case people run out of funds and need to have an availability for resources for foods. The other piece is that we use an evidence-based curriculum called Eat Smart, Live Strong, which helps us to focus on improving fruit and vegetable consumption as well as physical activity. And we all know that looking at Facebook, buying off of Amazon, on our Instagram are not activities that get our blood pressure up. They're not things that reduce fat intake. All of those things really need physical activity. And so part of that program will be launched in our senior centers first, where they will get a physical activity workout as well as nutrition ed. And I just want to thank my staff for being here today, Mr. James Smith and Tasim Muhammad, who are in charge of our healthy stores. I would like for them to stand. They are in charge of healthy stores, virtual supermarket, and nutrition education. So thank you guys for attending today. So as we go to the next slide, we can see our obesity, our projected prevalence of obesity here in our city. And so the reason why I want to keep going back to the maps is because if you look at all of our healthy food priority areas, you will see that they're still very relevant. They're all relevant in the same areas of the city. So you will see West Baltimore, Upper Northwest, East Baltimore, all still very much are colored intense intensified red or intensified orange. And if you go back to the very first slide, you will see that they are also healthy food priority areas. If we were really creative today, and it's just because we're not going to have a lot of time, you would also see that we have chronic diseases are more prevalent in those areas where there's intensified orange and intensified red. And so we are projecting that those are still our areas. So remember, a healthy food priority area does not have a market or does not have several healthy food priority areas in terms of a corner store. So our maternal and child health, we work with state and local government workplaces, our insurance providers, and other entities to create policy. So when Councilman Burnett said that after all of these hearings, we will look at policies that we can use here in the city, I'm pretty excited because we need some policies to enable us for an environment that is healthy and that we are getting active. And so in maternal, child, and health, we work with entities to make sure that we partner with them in order for us to have great outcomes for birth. As you can tell, 1 out of 10 pregnancies in Baltimore is diagnosed with serious conditions related to high BMI, including hypertension. And so really, if we go back to those same areas on our maps, you will see that because of that, mothers do not have resources to healthy foods, and so that creates a high BMI and hypertension. Mothers' experiences related to weight and nutrition with health care providers and in the community also contribute to poor birth outcomes, and weight stigma can have tremendous impact on health as well as development. So what we do is we partner with WIC. And so part of that is if you live in Maryland and you are pregnant or a new mom up to 6 months and or breastfeeding up to a year after delivery and have a child under the age of 5 and meet the income guidelines and have a nutritional need, you are eligible for WIC. So the benefits are loaded monthly. You get breastfeeding support, you get nutrition ed, and you also have a holistic view of getting lead and blood screening as your child grows. We are in 8 sites around the city with 15,000 enrollees. Hopkins has the additional 9,000. So if you go to the next slide, you will see that the current sites, and most of the sites are still located in our healthy food priority areas. So we are doing our best to keep up with that demand. So the next thing is we want to increase the number of women who enter pregnancy at a healthy weight. So we know going into pregnancy you have to be healthy, and that includes a series of things: having a great family and community support around diet and fitness, being able to counsel women on diet and fitness, and have accessibility to healthy food, fitness opportunities, and weight loss programs. And that is all essential to be more fit for healthy babies and home visiting. So someone comes out to ensure that that is what happens for our pregnant moms and newly birthed moms. Any questions?
Councilman Emery?
Thank you.
Appreciate it.
I'm sorry. I tried to take notes as we were going.
I know, it's a lot.
So on the map of the virtual supermarket sites, where it says on the next page that there are 13, I see 9 and they're all on the west side.
They are on the west side, and the reason why they're all on the west side is because our virtual supermarket vendor grocer only delivers on the west side. So as of this year, we are looking into another vendor who will then go to east side. We lost a vendor because Santoni's was the vendor that we had, and then we had another virtual supermarket site in Glen Burnie who would do the east side. So we have to look at another vendor who will assist us with the east side.
But the other question was, this really looks like 9.
It does look like 9, but we've had 13 in total in FY19.
You've had 13?
Yes.
Okay, so these are
the 9 that you see up are actually current. In FY19, we had 13.
Okay, and then under healthy stores, healthy corner store sites, I wanted to make sure I was getting this. These aren't all the stores that are actually doing the stuff you're talking about. These are the ones that have worked with you so that you know that they're selling stuff.
So these stores are actually stores that are contracted through the health department that are indeed selling healthy foods.
Are you connected with the Fresh Crate program?
We are not connected. That is entirely different. We partner with them, but they are not our stores. They're not included in this number.
No, I get that, but you're aware of them?
Yes.
Okay, and so they don't qualify?
They would qualify, but they're not internal to the health department, that we don't have a say of what they stock or how they deliver. That is organized out of Loyola College.
Right.
And so we partner with them, but these are actually through a MOU that we go out to do quarterly visits to, whereas they go to their stores weekly to take orders, and they stock their own stores. So we have a different model in reference to Loyola.
I get that there's distinctions in terms of how they're set up, but other than that, are you assessing those stores to see if they are meeting the same qualifications?
We would not assess those stores because they're not under our program. They're under Loyola's program. I understand your question, Councilman, and that's why we partner with them. But these were under different grant funds, like they're under different grant funds.
Okay, I guess.
But we don't discount them as healthy stores. Because this is the health department's presentation, we list out what our stores are, and then we talk about our partners who are doing the same thing. Not unless you would like for us to, because there are several stores on the east side under Hopkins School of Public Health who also have the same type of program. We all were under the same initiative when it first started,
Okay.
and so we all have collaborations over the past.
I thought it might be helpful, especially if we're gonna share this with the whole council.
Okay.
It might be helpful to have maybe they're different colored dots.
Okay.
But to show as many different stores that you're partnering with that are trying to.
Okay.
I know we're not all in the same car, but if we're all going the same direction.
Absolutely.
Okay.
I think that's a great idea. We can talk to Fresh Crate, and then I can talk to the School of Public Health at Johns Hopkins and see where their corner stores are located.
Okay. I've been ordered to talk directly into the microphone.
And if you could just send it to the committee, we'll get it out to the council.
Okay,
We
absolutely.
even have this up here saying, please speak clearly into the microphone.
And we never do it.
And we don't do it enough. One last question.
Okay.
I was curious about the concept of projected prevalence of obesity. How do you project that?
So I am going to ask Amanda to come up to talk about, I tried to make sure that Amanda didn't have to come up, but she can talk to you about how we project the data here at the health department.
Okay, thank you.
Thank you.
And Ms. Green, don't go far, because I had a couple questions related to the other program. Thank you.
Hi, I'm Amanda Smith. I'm an epidemiologist at the health department, so I'd be happy to explain that, because I know that's a confusing concept of how we're guessing what it looks like.
The concept of obesity is not confusing.
No, but how we're getting this map,
I was
yeah.
curious as to what data you were working off of to be able to say so specifically that, in this area, 40 to 43% of the people are probably obese.
Yes,
Okay.
of course. So unfortunately, we don't have measurements at this level for Baltimore City with obesity. We would love if we did, but we don't. So you have to go about other means of making this work. So the way that this works is there's national studies that take place through like the CDC and other organizations, and they get kind of baseline measures through surveys where they sample different parts of the population, and we take a sample of the population, and we use that to say, if it's a representative sample of the population, then we can kind of say, okay, if 5% of people are obese in this area, then if that's a smaller sample of this area, then we can kind of guesstimate that overall then in this whole population. So the way that it works on this map is there's one project, it's called the 500 Cities Data, which you see listed down there by the CDC, and they gather data for 500 of the largest cities in the United States, looking at all different health measures, obesity being one of them. And so they're taking the measure for a larger population and kind of estimating then for smaller, like these census tracts for cities all over the United States and getting an estimate of what obesity would look like based on the larger percentage. So an example of how this would be done, because I think this would be more helpful to understand this, is if we know that overall in Baltimore City, let's just say males that are 40 to 45, obesity is 20% overall for Baltimore City. Then we can look at the individual census tracts and say, okay, in this single census tract, there's 45% of the population is males that are 40 to 45. So then you project onto that smaller census tract that measurement for the overall population that we have. It's imperfect, but it's the best way that we have to estimate what is going on in the population. So that is, yeah, follow-up question.
So now I understand it, and I'm a little bit nervous, because that seems like a lot of people are making a lot of policy decisions, and and a lot of places are making a lot of assumptions based on a national survey, a group of national surveys. Yeah, I mean,
there are individuals from like Baltimore City that are answering these surveys. It's not like we're looking at the whole United States and it's supposed to be
okay. That's what I was.
Yeah,
okay,
sorry. It's supposed to be representative. So we're not saying that, just because obesity in this population in another part of the United States that's not anywhere comparable to Baltimore City has that. It is in some way representative of Baltimore City. And like I said, we would absolutely love if we could go out and sample every single individual in the city and know what these numbers look like. But unfortunately, that's just not possible. So this is the best way to go about it. And this method, which 500 cities, the statistical methods that they use, it has been validated in other cities. So we have a pretty good confidence in the fact that, yes, there might be some errors, a small margin of errors, but pretty good confidence that the way that they're going about this is maybe not 100% accurate, but at least gives us enough confidence that what you're seeing on this map, even though it is projected, it most likely is very close to what is actually going on in the city of Baltimore, and especially the areas that we're seeing it. And we know chronic diseases are in these areas. We know socioeconomic factors in these areas. So we have pretty good confidence when looking at this that it is pretty representative of the issue at hand, even if it's not perfect.
Okay. All right. Thank you.
Yep. Thank you.
Councilwoman Clark.
Oh, hi. Oh, don't go. I don't know who to talk to, but well, I mean, basically, we see this map all the time: lead poisoning, poverty, other problems, and so it doesn't. To me, it's like, oh yes, the butterfly is back. So what I wanted to ask you though is, what in your efforts, what are you calling healthy food? Like, there's something about Cheerios being at eyesight, and yeah, okay. Like, so the health department's undertaking to make sure people have healthy food. That's a very interesting subject, because a lot of people have different opinions about what is and what isn't healthy. Now, you're looking to help people be healthy, so it's not just about obesity. I presume it's about your heart, what kids should be eating, and I mean, what's your menu here?
So actually, that's a perfect question for us. So we got lots of consultation around what is considered healthy from our colleagues and our sister city in Philadelphia, who organizes the Food Trust. So the Food Trust is a nonprofit in Philadelphia that works with all of their corner stores to ensure what is healthy. And so what is healthy, we're going by the guidelines of the CDC and the FDA, which is considered healthy. And they did a whole presentation for the staff of the Baltimore City Health Department years ago on what would a healthy corner store look like. So while the corner stores all have a variety of things that are housed in it, there are still some things that are considered healthy. So if we go into a corner store that has no milk, whether there is 1%,
Milk is healthy.
milk is still healthy. If they have,
Still,
it
right.
still is healthy, not unless someone says something different, right? If we walk in the store and there's no water, would we still consider that a healthy store? And we would not consider it a healthy store because one, we know that the body we need water.
But don't we get water if isn't it really the same as what you get in your house when you turn on the faucet if you're not homeless or something, but
So believe it or not,
pay
probably,
money to get something that you're paying money to get.
and believe it or not, we spend an enormous amount of money purchasing water. They want you to talk in the mic.
Okay, I'm sorry, I have to speak into the microphone. We each have our own sign that tells me that. It's personalized.
So we also have, so the Food Trust did some consultation with us around what is considered healthy. So again, we're following the SNAP benefits. So SNAP benefits are those that you can go and use at your,
SNAP.
we're following SNAP, we're following WIC, and WIC is the highest standard.
Philadelphia.
Yep. So, and we're literally following the consultation of the Food Trust in Philadelphia.
Yeah.
So we have a list that we can provide to you all, which shows what we consider
I'd
healthy.
love to see it.
And actually, there's a checklist that the staff use to go out, and that's how we monitor whether or not our stores are still continuing the model of what is being healthy. The second piece of it is that we then every year go to see if they have tobacco citations, whether or not they've sold tobacco to minors, because we still feel like that is another component of being healthy, is whether or not they've sold to minors. And if they have, that's not healthy. So we can't stop them from selling tobacco, but definitely selling to minors.
Well, that's good. I think that if you would let the committee
I
have
will.
that list of, the coordinated list from all these sources, I think it would be very helpful. I know
Okay.
I'd like to see it.
Okay,
Thank you.
thank you.
So I had a couple questions, but I'll hit on something you mentioned recently that wasn't in your presentation, but I know that there was a small briefing for the council around the cuts to SNAP and the impact. Can you speak to how the health department's responding to that? It's I think 15,000 people impacted at least in the city of Baltimore, but can you expound on that a little bit for us?
So I was probably not the one that gave that, but I will go ahead and try to respond to your
it wasn't.
question.
It was not you. Yeah.
So I think that what we're trying to prepare for is that obviously there was a cut in SNAP benefits to, and I'm not sure what the impact of the number here is in Baltimore, and I think that's something that we have to go back to the Office of Sustainability, because I think the Food Czar probably has those stats as it pertains to us. So I think with internal to the health department, how we are going to prepare for that is to really identify food landscaping. So internally, we have talked about really identifying food pantries, where soup kitchens, and also our other partners who provide discounted fruits and vegetables to communities each week. And that is going to be essential even to the work that we do, because in the food landscape, we have a lot of resources, but those resources often aren't coordinated. And so what we will be doing internal to the health department is coordinating our resources so that when citizens call or ask us, hey, I want to eat healthy, or I want discounted foods, or I can't afford it, where do I go? And so we do have partners called Hungry Harvest, and what they do is that they weekly throughout Baltimore City, they have $7 a bag for fruits and vegetables. The University of Maryland Mobile Food Market, which is absolutely phenomenal, they did a presentation for the health department recently where they do the same thing. So they're providing fruits and vegetables weekly in certain neighborhoods. And then if you don't have the money, they will give you whatever is there, because they don't want to turn people away from not being able to eat healthy. So we'll be working to have kind of a landscape of where resources are, how they're operating, and then the health department will be the depository for that food landscape.
Awesome. Okay. The other couple questions, two other questions. One is about the virtual supermarket program. Can you walk us through how those are established? Like, how does a senior center, do you have to be a senior center to be a part of the program? And yeah, can you just sort of start us
Sure.
from the beginning on that?
So originally, we tried virtual supermarket in community centers, and then we tried them in senior centers. And we had more customers ordering from the senior center than we did from actual community centers. And the key to that was that when you're in the senior center, everyone is there. So you have a volunteer who knows the residents, who can assist the residents with ordering. And the best part of virtual supermarket, and I would invite you all out to visit one of our locations, is having that senior not have to leave that building to pick up their items. And literally, they don't even have to pay on site. When their deliveries come to the center, they pay the actual vendor their money, and then someone takes their deliveries up to their apartment. And I would love that for myself. But honestly, I think it works. That model, we've seen it, we've refined it in the last year and a half at looking at how well we're operating. When we've had it at the community centers, that spot really has to be marketed well, because literally we're not taking it to where people already exist. We're asking people to come to that site, which is more challenging than having it right on site. So in a community, we have to determine what the feasibility is going to be for the vendor as well.
Okay. Yeah.
But we're still exploring. I think that we're looking at Waxter Center, because actually the Waxter Center has so many seniors that come on site who don't live in that area. So we're going to explore that option, but we really do need another food vendor to assist us with that.
And just out of curiosity, because I know the ShopRite is in the Howard Park community. Is Forest Park a part of that? The Forest Park Senior Center in this program?
They are not, because they are in walking distance to ShopRite. So that would not make them a healthy food priority area.
And that makes a whole lot of sense. They can go right there. Did you have any questions about this? And I had one more unrelated to this. No. Okay. And then I guess the last question for you, and I'll take you up on the site visit. I'd love to see that in person. How do you, so when we look at we've been through a number of these hearings, and as my colleague said, we continue to see the same map. How do you measure the success of these programs as it relates to reducing, in this instance, we're talking about obesity and these health outcomes. How do you measure the impact of these programs as it relates to the sort of social outcomes that we're seeing on the ground? What are some of the metrics that are used there?
So one thing that we're using internal to even healthy stores as well as the virtual supermarket is looking at outcomes. Are we providing a holistic approach? Because even if I have access to healthy foods, it does not mean that I'm going to order. It doesn't mean that I'm going to purchase the healthy foods. So we had to add the component of nutrition ed in order to do that. So that's one piece that we will be starting to measure. The second piece that we're going to measure is, are our sales being impacted now because we have education in place? So while we know that people are going to purchase foods that are healthy, we don't necessarily know that people are eating healthy as a result of having access to it. So the nutrition ed will help us get to that one level. The second piece of it is that how we're also measuring obesity is that we have to partner these activities with something else. Because our senior centers have been involved in virtual supermarket now for almost 10 years, and we've evaluated sales, but I still see Pepsis that come into the door. So are we really impacting health based on providing them with a service? So that is why we're going to put in tobacco cessation, which we did in the fall of 2019, because we still have seniors who are smoking, which impacts how healthy I am. The second piece of what we're going to put in is a virtual workout. So some of the senior centers have agreed to enter into a virtual workout, which will be a video of a very low impact workout. And so at those senior sites, we're going to monitor if the ordering is now healthy, is now the tobacco cessation class is working, and are we now seeing people who are participating in nutrition ed? But I think that we can't solely base it on just the delivering of foods, because like I've said, having access to healthy foods doesn't necessarily mean that I'm going to purchase them or I'm going to eat them. If I don't know what a rutabaga tastes like, I'm not necessarily going to eat the rutabaga. But until you give me a recipe that is tasty, then I will consider it. So I think that we have to start giving exposure. So some of the nutrition ed will happen in our senior centers, and then it's going to happen in our schools, because we understand that there has to be a generational gap that we fill. Because like I said, it was terrible to go to an elementary school and a little boy say to us, "I've never tasted an apple before." And that's heartbreaking, because I might know what the apple is, but I don't even want to taste it because nobody's ever exposed me to it.
Councilwoman Clark, you had a follow-up?
Yeah, I just want to talk about kids for a minute. Not the school system program, not that, but what you're doing. I have 4 kids under the age of 5, and we had a limited budget, and there wasn't nobody worried about health in those days. That was 1,000 years ago. These are all grown people now, my 4. But I remember shopping, and I remember shopping with, you won't believe this, but in those days, I could only spend $15 a week. But things didn't cost as much as they do now. So I carry a little clicker. And what I'm getting at is this. I also was very busy at the time, and the 4 kids, and all right? So what I tended to buy for us was things that were easy to fix, that they liked and would eat, and that didn't cost very much. And I bought it like in a package. So mac and cheese, as often as I get away with it. I would take some kinds of soup. I don't believe I did this, but I wouldn't dilute it, and then I would pour it over like rice or something. It filled them, and they liked the taste, all that kind of stuff. So when you going and you're healthy fooding these corner stores, are there things you buy in a package that you don't have to learn how to cook a rutabaga or whatever you call it?
Absolutely. Well, no, there are no rutabagas in any of our healthy stores, but there are.
Believe me, I don't even know what it is, and I couldn't. I know my kids wouldn't eat it. I got to feed these kids.
And so that is a key piece. What you're saying is so very true and valid in reference to our neighborhoods. And so that is why, to participate in our healthy stores, all of the healthy stores have to have something in it to make a complete meal that's healthy. So even if I'm going to use, and this is a terrible example, but we've had this discussion internally, even if I'm going to have ramen noodles, which are high in sodium, what vegetable can I add with it that's sold at the corner store?
And kids eat it?
Even if the kids eat it. So what will happen is that we will suggest having frozen broccoli, because frozen broccoli is still in that corner store. If they decide, okay, well, I don't want the frozen broccoli, because my son, when he was little, he did not want I'm not eating broccoli, but then they have canned foods that still represent something that's healthy. So that's why I said we literally range it based on people's budget. It's not going to be a Whole Foods or a Wegmans. It really is going to be based on what is currently in the healthy store. And so the health nutrition educator will go out and say, okay, based on what's in this store, this is what you can get for what you budgeted, and this is considered healthy.
And it would fill kids up so they're not hungry.
And not hungry.
At the end of it.
And that's why we still encourage water, because a piece of it is if you're constantly giving juice, that's not healthy. But if I'm having soda, that's not healthy. But if I'm drinking lots of water, it fills you.
Good point.
So I'm going to shout out my public ally, Tassine. Tassine made for us last week in the office, because even our staff have to be healthy. So she made for us blueberry muffins. Now, it was not blueberry muffins, so she did us a shake. She did us a shake with blueberries and literally put granola on top. It was fantastic. Everybody in the office grabbed it. It was all gone. And the key to that is taste. So we have to sell people on taste. And so literally, because I'm not a foodie, I know I'm the director of health promotion, but I'm not a foodie. I literally ate mine, and it was fantastic. But she is our educator in the corner stores, and that's what she's going to be doing, is to expose people to taste and what is nutritional and what tastes good, because that's the key to eating healthy.
What the kids will eat.
Right.
Good. sometimes you just have to not be hungry.
That's true. So that's why we need the physical activity, because it's a holistic approach. It's not just me. Sometimes I have stress triggers that make me want to eat versus, and all of our communities
all
are
do.
stressed. So we want to make sure that we're doing it from a holistic view by getting people active, getting people healthy, and literally that's why we've put our tobacco cessation classes in those same areas as well.
It sounds like you've thought it through very well. And I'm from Philadelphia,
I
so
love
I know
Philadelphia.
you have a good model
Yes.
to work with.
We good, Councilman?
Yeah, I'm done.
So the last question I had, because I know we do have other presenters. You mentioned the landscaping and partnerships with the school system. Can you talk about the relationship with Maryland Food Bank or internally with BDC, Baltimore Development Corporation, as it relates to like being able to recruit other businesses into food priority areas? And also, what does the relationship look like with Baltimore City Schools? You mentioned working in classrooms. Can you just expound on that? So sort of partnerships and the school partnership in particular.
Okay, so let me start with Baltimore City Public Schools, which has been a great partner with us. We work in the health education department, who has to clear us to be able to come into schools to even offer anything related to health ed. And so part of that is going in with an evidence-based programming, because that's by law, we have to have an evidence-based programming in order to say to the kids, this is what you should be doing. So we sometimes partner with our tobacco prevention and use programs in order to provide nutrition ed. So probably starting in this, right now, we're going to be starting to partner to offer both. Probably by fall 2020, we will be in schools that want us to come in, because obviously the principals have to clear whether or not they have the time for us to have nutrition ed. The second piece is that we still have community organizations that we partner with in order to do that. So when we're out doing the enormous amount of activities throughout the summer, we are still doing what we do is called Sugar Shocker, which is a presentation on how much sugar is in a particular drink. So, so while you think that Gatorade is healthy, Gatorade has the most sugar and probably not something you should be drinking in reference to now just a plain old bottle of water. And so that is education that we do in the community that we will be providing during the summertime. The second piece is, so let me talk about partnerships. The Baltimore City Health Department really has undertaken a focus on diabetes. I don't think that we're ready to really talk about the nitty-gritty pieces of it, but what I will say in our internal discussions for the last several months is partnering with the Maryland Food Bank, partnering with Hungry Harvest, University of Maryland Mobile Food Market, to really look at how we can make sure that we get access, or people get access to those services. And I think once we are ready to unleash the strategy for that, there may be a time to call us back to really have a more thoughtful conversation about partnerships with them.
Okay, will do. Okay, thank you very much.
Thank you.
She did talk about stress eating.
She did. Okay, so
No,
Dr. Peterson here from Morgan State University. Thank you.
thank you.
Good morning.
Good morning.
Yes, good morning. The handouts.
You have a presentation we got to load up?
Yes.
Okay. She's going to.
We're talking about real foods. I'll bring it. You'll bring it. Here, the handouts.
I think you have a copy. Yeah.
Oh, she has the hard fats.
Oh,
That one was the one on obesity.
oh my goodness.
It was the one on obesity. It's the other.
She's got something else there.
Yeah, this is the one. It's obesity.
Margaret did make copies.
What? Oh, is that it?
Maybe share that one. I thought she made copies, but.
This one is on the hard fats, but we have one on,
That looks good.
but we can talk about the hard fats, because.
No.
Are you talking about this one? Right, this, yeah. Okay. It's the next one. I think you all have.
We have paper copies.
Okay,
And
so
but-
Yeah, we do.
Okay, very good. And here are the handouts.
yeah, if you want to load it and she can get started.
I can get started, yes, thanks.
Mr. Chairman, just so you know.
All right, good morning, everyone. I'm so excited to be here this morning. Basically because food is my passion, and I teach how eat to beat disease, and I think that's where we are. We have a lot of disease around us, but we're not sure how we're going to address them, especially when we're dealing with individuals who may not have money to go and see a doctor, over and over again. So I'm going to focus a little bit this morning about the nutritional education piece, because I'm from Morgan State University, and wish you bringing greetings from our president, David Wilson, and we are here to make a change in our community. I am a new director coming into the university, Nutritional Sciences Department. I came in on the fall of 2018, and our goal is to change within Morgan Mile to make a difference in that community. We have made some curriculum changes so that we can increase the knowledge base of our students as they graduate, so that they can go into their communities to order to provide healthy nutrition information. Obesity, as you can see, just looking through the handout, is a disease that is affecting nearly a third of the American population. And, we talk about the disease and we talk about how it's a problem, but we want to get the solution. Many Americans, of course, are obese, 33% women. You know why women are more obese than men?
Not tall enough.
I'm an educator, I'm sorry, but because men have less fat cells. Men, you guys have a little edge on us that way, so you don't carry as much fat as women do. And we women, childbearing age, especially tend to have produce more fat cells. So over 60 million are obese, and 9 million are severely obese. And we wanted to just share a couple of the data, because it's good to see what the problem is, and then you know where you're going and what you need to do to change it. What we've gotten some statistics from the department, Baltimore Health Department, 1 in 3 are obese, and that was from the 2011 data. And of course, that obesity increases in areas where the income is below $15,000 per household. How can I tell if I'm obese? And you have the chart right there. So it's easy for a person, because sometimes they tell you, oh, I'm not overweight, I'm not obese, I'm fine, I don't have a problem. But then when you start trying to just look at their height and weight data, the BMI is called, you can see where the graph shows. Anything over 30% is we're in the obese area. The contributing factors: high calorie diet, lack of exercise, socioeconomic factors, and of course the biological factors are hereditary, the genetics. Okay, there we go. All right, that's the graph. All right, so we're right on track now. Hereditary, genetics, because if you can't change who your mom and dad are, but you can change your lifestyle, and that's where we're going. Metabolic factors: fat cell development, sex, again, female have more tendency, age as you get older, less sedentary, and more sedentary and less active, race, ethnicity. So the high calorie diet, this is where we come in for nutrition education. All right, so American lives on fast food diet, eating foods with high sugar, fats, and refined foods, eating more than 2,000 calories for women, and men over 2,500 calories. The other things are big serving sizes, and so one of the things that we want to do as we're looking at reaching the community and helping to make some changes is to show them what the real fast food is, and I'm going to show you. It's right in front of you. Real fast food is not what they're getting there, what they're being served. I mean, they get it quickly, but it's not what we want for people in a healthy diet. And then the other factor is portion sizes, showing people how they can still eat foods that they like that may not necessarily be as healthy, quote unquote, but the portion size is important. And then, of course, we want to add exercise as we go a little bit further. All right, so our next slide. Lack of regular exercising. Recommended at least 30 minutes a day. And most of our young people and the older ones are in front of that, I call it I'm sorry, ignorant box, but it's a blue tube, and people are looking at it day long, and then the children now are on the young people are now on the cell phones. And you know, I have noticed that when people start walking, you see people walking now, nobody's looking up at you and saying, hello, good morning, where are they? Everybody's walking, looking at this. But anyway, just wanted to share that we can use this device, this cell phone, to help them. So lack of exercise, and we recommend just 30 minutes a day. What are they at risk for? With the obesity issue that we're just mentioning, type 2 diabetes, heart disease, the number one killer, still is the number one killer. I'm very passionate about it because we can change this. This is not something that has to be. High blood pressure, high cholesterol, osteoarthritis, sleep apnea, gallbladder disease, all types of cancers. They're all over 40% of these problems are directly related to what we are eating. All right, so what are some of the solutions? We're looking at using moderation, balance, and a wide variety. When I teach classes, I tell people, do you like a BMW? Everybody wants a BMW. And so I said, you will leave with a BMW in my class. Balance, moderation, and a wide variety. You've got your BMW to take home. And of course, they laugh a lot about that. Staying with your recommended caloric intake. So people need to know how much they should be eating. A lot of people don't know, they're just eating and eating because it tastes good. So tasting good is good, but it's not always the key to helping you to remain healthy, because you can eat some really good tasting food and eat a lot of it. So getting out there and exercising, and of course the one that I'm a passion for, water drinking. My husband tells me that's my weakness, drinking a lot of water. Water can make a lot of difference. Do you know most of the people that walk around that we see day in, day out are, guess what? Dehydrated, and they don't even know it. How much water have you drank? Oh, I didn't drink any water this morning. Well, when are you going to drink some? I don't know, but I got some juice, you know. So some of the things that we are talking about are very simple, and they are not difficult to make changes for. All right, so as we're closing out, I think that was our last slide. So I just want to talk a little bit about what we are doing in Baltimore City Northeast. Here are the handouts. Because we talked about this diet and the plate.
Yep, we have it.
You have these?
Yep.
Okay.
Thank you. They have it already.
Oh,
Are there extras? We're good. Yeah. Send it down.
oh, sorry.
So it was really a great presentation earlier that talked about the foods where they can find them in the healthy stores or stores that serve healthy food. But when those foods go home, what happens to them? We're not so sure. So what we're trying to do through the Morgan State University program, we have a huge commercial kitchen, is to start teaching people how to prepare healthy foods. So it's not something. If you go in many of these folks' homes, their kitchens are what? Beautifully laid out, but nobody is cooking. Home economics is now out of the school system, and so we are trying to make that change. I believe if we can come in and start showing our young people how to prepare healthy foods. So we have a program working with the elementary school in Govans Elementary School in Northeast Baltimore. Not myself directly, but we're co-partnering with another group, and it's called Chef for a Day. So the children, there's 3 to 5 year olds, they're starting to teach them how to be a chef for the day. So they're teaching them how to look at the food and to play with it, to look at it, you know, and these are we're only dealing with foods that come from the land. We're not using foods that are in packages, because the packaged foods, you can always read quickly on the package, put the water, boil, it's easy. But to take the foods that they can see, the broccoli, you know, to touch it, feel it, and says, okay, what is this? It's a strawberry. It looks kind of funny, it's pretty, it's red. And so they look at it, we talk about it, and then we get at them to slice it and see what's on the inside. So we're teaching them how to communicate and connect with food. And if they connect with it in the right way, we find that they want to eat it at the end of the day. So what has happened over the past couple of years, this program called Chef for a Day has increased the confidence of the children, and they're doing a lot better in the schools. They're not feeling down when somebody says something negative to them, and then they're going home asking their parents to help them with this type of eating. So it's basically only the foods that come from the land. So, and you know, the year 2019 in America was called the year of vegan. And so we are trying to present, you know, there's a diet plate that's out there that has been given by the USDA and FDA. Half of that plate, they're saying we should be eating fruits and vegetables. So we are focusing on that half of the plate that will help increase their eating on fruits and vegetables. And if we can succeed properly on that, guess what we will do? We will solve the problem of obesity and heart disease and all these other things that we're talking about. It's as simple as that. And I believe it. I'm over 70 years old, full of energy, and still going strong. I've been a vegan for 50 years. I grew up as a child and did not want to play with they were killing the animals that I was playing with. And I determined that I was going to be an advocate for eating more fruits and vegetables. I've served in many populations around the world, India and all of these places I've gone, and have 3 cookbooks. So Morgan has begged me to come for 2 years, so now I'm there to help make some changes. So I am hoping that we can get some support from the city to focus on that side of the plate, the fruits and vegetables, because that's the area that many of our young people and the low-income ones are missing, and they don't understand how to enjoy it. So we'll show them how to do so, and hopefully we'll make some changes. So I appreciate your time. My colleague is here with me, Dr. Tucker, and she has been with Morgan for a long time, and we're joining together with forces to, the thing that we're saying is I will eat the original the original fast food, which is fruits and vegetables. So thank you for your time, and I hope that we can get to communicate some more, and you can hear more of what we're doing at Morgan State. Thank you.
So don't leave. We did have a doctor. Sorry, we always have questions.
Oh, yeah, questions. Yes, I see.
One, thank you for all you do. The first question that I had 2, and then I'll move to the committee. You mentioned working globally.
Globally, yes.
One of the things that I've noticed as I've traveled
Yes.
to different continents is that the sort of the culture shift, or the culture piece that in so much of American culture is based on fast food and easy consumption. And I'll even put myself on blast and say that, you know, the first time, my wife is Haitian, and the first time I cooked dinner for her, it was like, I don't know, it was like a packaged, I can't remember what you call it, hamburger helper. There we go. And I thought I was doing my thing. Like, I had the beef and the, you know, high sodium packets and everything else. And she had literally never had that before, and had grown up in a household that just did not make that kind of thing. Like, everything was made, rice, beans.
Yes, from scratch.
Everything was made from scratch. And I mean, she ate it begrudgingly, but was just sort of confused. She does love me, but was generally confused as to, like, wait, you eat this kind of stuff all the time? And like, she opens my freezer and I have like Hot Pockets and microwavable pizzas and all kinds of stuff. That was just how I grew up. Not, you know, with just, I didn't have any disdain for vegetables, anything like that. It was just, this is what we had. This is what I knew. How do we make a culture? I mean, it's obviously a big question, but in your research, what do you think are the needs to really shift that culture? Because I feel like if you grow up with it, and when I've been to West Africa, East Africa, you drive on the highways and like you see these like fruit stands and vegetable stands. Like, that's the equivalent of the 7-Eleven there. You just pull over, you grab whatever on the side of the road, you eat it, and the access is there. But you can tell the expectation for it to be there is also the case, and so I'll stop there. But just, I think you know where I'm getting at is like, how do we really shift the culture piece to view this as just a normal thing that we consume?
That we do. One of the things that we are finding is that people eat by not just by the food, but by sight. So if we can at least show as many places where this kind of food is really what you want to eat, especially advertising. See, the advertising is what is driving the people to, quote unquote, the fast food places, because they talk about it and they give all these little gadgets or what have you. If you come here, you'll get this and you get that. We have to make the change to advertising the kinds of foods we want them to eat to make it much more attractive. And I see a lot, as I said, 2019 was the year of vegan in the United States, and I had a restaurant in Colombia, and back in 1995, because as I said, my passion for this food, and a lot of people came, but I was so far ahead of the game. They don't know where I came from with these ideas, but the Rouse Company in Columbia, Maryland were just excited, but a lot of the people said, I like this, but it's not really my way of eating, and I can't do this all the time. But I think that we are now on the road to this type of experience because the advertising. The other great thing is a lot of products are now being available, very easily put together that people can use, and the Food Network. So this Chef for a Day is a thing that came right from the television, the concept, and we're starting it with the small children. My goal is to see us raise a new generation of children, growing a new generation. And we have the 3 letters. We say you grow, you go, and you glow. And these are the foods that will do this for you. So you want to go, you got to eat those good carbohydrates, not that other stuff that's there. And you want to glow, you want to eat more fruits and vegetables, and you want to grow, you eat the right protein food so that you can I want them to go up, not across. You're teaching different concepts to kids, and these kids at Govern's Elementary School are very open. And I did it in Washington, D.C. Last fall with elementary school down by the district, and the children loved it. They actually were hungry whenever we came with the demonstrations. So if you can show people how to fix it, how to prepare it easily, quick. The recipes need to be less than 30 minutes. You can't have stuff where a lot of ingredients. Very simple. Then they need to go to the grocery store. Those things that came out on the basket are from my kitchen, my grocery store. I got it to the grocery store. All these. They're all over the place. $15, all of that stuff costs. So, that's the way to go. The strawberries were $2, the bananas were 45 cents, and, you wonder how you can eat that way. So we have some ways of making it happen, but we have to start with the children and then get the parents to buy into it. Because when the children go home and they want to eat this, the parents are saying, I don't know, what does that look like? I don't want to do so. So we want to also connect with the parents. So this summer we're starting food science camps so that they can understand the science of food and how that food can make a difference to change their health. If they eat that way, the data is there for it. The data has shown that it works. So I went 3 times in Switzerland, working in Switzerland, and Switzerland is a great place. They don't have fast foods there. They don't have, But back home in my island of Trinidad and Tobago where I was born, so sad. A lot of fast foods have come in and the disease process has gone up. It is just so parallel, the correlation. So if you switch it, you're going to get the results that you need. So, and I know that's what you all are looking for, the results of healthy people, and it can happen. Yeah.
You had a quick follow-up,
I
Councilwoman
just
Clark?
have a quick question, and I have to excuse myself then. But thank you so much for your presentation. Okay, so Waverly Elementary School is within the Morgan Mile.
Yes. Mm-hmm.
And the principal there, Miss Green, is
Right,
trying to get summer camps
Okay.
to let her know what's available for her children there at the school.
Right, yes. I'm
So that
connecting.
she can work on getting her children into camps.
Right, so we are
Now.
connecting with her for the summer. 'cause I-
Okay, so are you working with her already?
Yes, Ms. Green, yes. I
Okay.
haven't talked to her since this past month because we're right now sending up a grant to work with AmeriCorps so that we can do some more work with them in the city.
Okay, well,
Yes,
then
so
you're
I will
going to be
getting
in
back
touch.
to her.
She's trying to, she's going to have an exhibit of people that run camps
Yes.
on the 2nd of May, but that's very late for
okay.
people, parents to come in and choose a camp.
Right, yes,
So right
okay.
now, they're working to get the older kids into youth works.
Okay, yeah, because we're
And-
working with the younger
and,
kids, yeah.
So they can go to camp as employees.
Okay.
And so I hope that you'll connect.
Yes,
please.
we will, yeah, again,
Thank
with
you.
that
And
older age
excuse
group.
me for
Yeah,
needing to
that's okay.
leave.
Thank you so much, yes.
Yeah, great.
And I had
We're
one
done?
more
Okay.
question for you. How do you find out what your recommended caloric intake is? So you presented BMI information.
Right, the recommended caloric intake, I mean, how the person can find out?
Sure, yep.
They're one of the easiest ways to do it without having to go through a lot of, information. As we do classes, in churches and other areas to help individuals. You take your weight and you multiply it by 10, and that tells you how many calories you should be eating a day to stay at the weight you are. So if I want to be 120 pounds, I would need to eat 1,200 calories a day in order to get to 120 pounds.
Okay. And if you wanted to lose weight,
If you wanted to lose weight, what you
times
mean?
8 or something? 5?
Yes, right. So if you want to lose weight, one of the technical ways of losing weight, this is all statistics, but it doesn't always happen that way, you have to eat 500 less calories a day. So if you're eating maybe like a Big Mac or so, you take that out, and that's more than 500, you will lose a pound a week. So 7 days of 500 calories less intake gives you 3,500 calories. That's how you can drop 1 pound. So we show people how they can start working on losing the weight. But people with large amounts of weight, it's not going to happen that easily, being honest, because there's a lot of other factors involved. Hormonal changes and so forth that causes people to start blowing up. And of course, a lot of the foods that they're eating are actually foods that's causing them to gain weight. Yeah, so not just the portion sizes, but the things that are put into the food. So we teach people reading the labels. You got to read the labels. But you see, the foods that I've just shown you the calories are very minimum because it's just grown. So the other thing we want to start doing, Dr. Tucker is involved with that, is community gardens. So we're going to be starting the gardening concept and having individuals, grow their own foods, their summer foods especially.
Okay.
All right?
Thank you.
All right, thanks so much, yes.
All right. Our final presenter is Mr. Eric Jackson, Black Yield Institute. And I think we have his presentation.
We have the slides.
Is it loaded already? You know which one it is?
It's too small. Yeah.
I sent it to you this morning, the one this morning, 8:45. What time was this? Like around 8:45, 9 o'clock this morning.
All right.
That's all right. We've got the hard copy.
We got the hard
Cool.
copy.
That's fine. I just don't. Well, let me
Doesn't
grab.
have it.
Actually, let me grab my
we
phone.
do
No,
it?
I'll get my phone and then you all can follow.
Oh, we've got extra hard copies.
Yeah.
Yeah.
Don't worry. We'll follow along that one.
Okay.
Yep. Sorry about that.
No, it's all good. All right. Peace and good morning, everybody. Thank you all for the invitation. I give thanks before I even get started with this and recognizing that the perspective that I'll bring is it's going to be a bit different than what we've heard and following in traditions of those freedom fighters who've sought to shift health conditions by advocating for and organizing to build power to shift land and food, the dynamics of land and food within communities. So my name is Eric Jackson. I am Servant Director of Black Yield Institute, and our organization works to address what we consider food apartheid, and we'll talk about that in a minute, and to do that through self-determination. And that's working specifically to organize Black communities to be in control of food and land resources. And so from the in this topic and talking about health disparities, I think that it is maybe self-explanatory, but to say that the reason why we have issues with health disparities is because of the same issues with disparities in land ownership and land tenure, and also limited control in the food options that exist in our communities that are rooted in power imbalances and rooted specifically in institutional racism and oppression. With that being said, recognizing that how we experience and how people on the ground experience food issues is rooted in a history. Many of us know about that history of redlining, and if you overlay the redlining maps that we have access to because of the archivists that have done amazing jobs, you overlay that with the current healthy food priority area maps, you'll see that there's a close resemblance of the communities that that still are impacted by these food issues. And so I won't spend a whole lot of time there because folks have spoke to that already, but I at least want to make sure that it's clear that this is an issue that is historic. This is an issue that has been lingering with us, and it follows the trajectory of race-based and class-based issues that I started talking about. And so you'll find that in Baltimore, about 1 in 5 Baltimoreans live in what city government, specifically in planning, and the folks at Center for Livable Future have called healthy food priority areas. But of those 20%, about 84% of them are Black people. Being clear about that, and everybody knows that, but we know that about 64% of our population are Black people, and as far as we're concerned, that is a challenge. One of the things that we're hoping to lift up today, and that we do in our work, is to recognize that, one, how we frame the problem is going to be reflective of how we frame the solutions to that problem. And for us, the problem is not a problem of healthy food priority areas or issues of food deserts. The issue is food apartheid. And food apartheid, or food apartheid as it might be described, is a condition, a socio-political condition that impacts communities, particularly poor, Black, and brown communities in our city and across the country at disproportionate rates. And we're talking about an issue that not only is indicative of, we're at the slide with food apartheid. So keep going. Yep. So we have an issue where, yep, keep going. Keep going. Here we go. All right, thank you very much. So and I won't, you all have the record, so I won't go into it, but what I will say is it is about the lack of distribution of power and not necessarily of particular resources, if you will. We believe that from our standpoint that the issues that we find are issues that are related to that limited access to power. Because we know that if you just place a grocery store, one, you can't just do that because of the market just doesn't allow for that, and grocers are looking at a particular profit margin that they're looking at. And so we believe that food apartheid is more so indicative of the types of, it was talked about a bit earlier, but predatory marketing, these high incidences of these health-related issues that impact families in very real ways. And so for us, because it is an issue of power and less an issue of quote-unquote under-resource, we believe that the solution has to be about building power rather than just adding resources or adding particular aids, if you will, programs that are not going to address the underlying issues. So for us, our frame is a frame that comes out of a global framework, a global movement toward food sovereignty. And for us, it's a branch of that Black land and food sovereignty, which we believe is a movement building approach where people should be able to define what foods are available in our community and control the markets that we're a part of. The councilwoman asked I think, very poignant question around I don't know, but if milk is healthy, and that's a conversation that I'd like to have if y'all got a question later about what I mean. But I think that ultimately, one of the issues while we are dealing with the types of issues we're dealing with is because people in the very communities that we're talking about are not defining not only what is food to us, but not having have as a part of the larger conversation connection to the types of ancestral foods that we come from, and foods that are automatically, whether they're vegan or not, going to be good for all of the health indicators that we talk about in social determinants. So for us, you can go another slide for me. Baba Malcolm X, that's all I'm going to say about that. He mentioned in one of his speeches that land is the basis of independence, and if we're going to materialize the American dream or self-determination, whatever you want to call it, land has to be a part of that conversation, and not just having access to land, but being able to control and have tenure and relationship with the land. And so for us, if you can go one more, please. I want to lift up that Black Yield Institute is not the only organization that's working toward building power amongst farmers, amongst community members, and other folks. These are just a few organizations that we work with that either appreciate our frame or utilize this frame itself. You can go to the next slide. However, I want to talk really quickly about what Black Yield Institute does and what we are doing, and then give some thoughts about some additional solutions. So currently, Black Yield Institute, in enacting or operating within the frame of Black land and food sovereignty, we operate in 5 different initiative areas. Currently, from a place-based standpoint in South Baltimore and Cherry Hill, we are working on establishing, developing a cooperatively owned grocery store, and we've been working on that for about 3 years. We're also operating an 1.25 acre farm that grows food, but that also is a space where people learn about agriculture and learn about Black history through agriculture and build relationships on the land. And then outside of the space, outside of that particular space, we are working in 3 different areas that we believe that are important to addressing these issues. Political education, so that we're building a base of people that are conscious of these issues. Secondly, we are working on an action network developing, coalition building, if you will, across organizations dealing with these issues, and making sure that we're centering the voices of the people who are directly impacted by the issue. And then third, we're also working on some research, recognizing that we have to be able to define the conditions that impact the people on the ground. And those are the 5 areas that we operate. I just did that quickly so we can get through. And then lastly, I do have some thoughts in terms of how we might be able to begin thinking about these solutions. You can go to the next slide. Thank you. So first, I think generally speaking, and you all have this for your record, so I won't go through line for line, but I do think that we need some legislative and some programmatic solutions that are going to, one, center, and I know that you may not be able to say that, and that's fine, but that center Black people. I showed you the statistics. About 84% of the people who live in so-called healthy food priority areas, or as we would say, experience directly food apartheid, are the people who should be developing the solutions. And so thinking about ways in which we can shift either what already exists in terms of, for example, the food retail strategy. We believe that the food retail strategy can be one that, in addition to recruiting grocers to come into the city to help to grow those that come from Baltimore City itself, I'd be joking if I didn't mention Cherry Hill Food Co-op that we're developing as one, but there are other efforts as well. And then also being able to center green development, if you will, as development. One of the biggest problems that I found in Baltimore City, I believe, is that when we mentioned BDC in the past, we've had conversations. They funded a project specifically with the food co-op, thinking about loans and other capital investments that help to grow these types of programs and types of ventures that will address the issues, but that also will build some sense of power and ownership within the communities that are looking for that. I think at large, that is generally speaking what I think should happen, and an overall prioritization of these types of efforts, rather than asking for solutions elsewhere, recognizing that the people who are dealing with the issues are those who can come up with the solutions. The experiential experts over the technical expert, if you will. So with that being said, I'll end with this, two quotes from two freedom fighters that are important to us, important to our work and how we deal with health, land, and food-related inequities. Thomas Sankara, the freedom fighter from Burkina Faso, said, "He who feeds you controls you." And so what we're ultimately attempting to do is shift that dynamic of control. And we believe that, again, just through the work that we're doing, we found that there are relationships that are being developed over time through the types of programs, if you will, or projects and relationship building, that we're able to not only control ourselves, but we know we have the solutions. And then lastly, Mama Fannie Lou Hamer, she's not the only person who said, the only thing that she said was not, I'm tired of being sick and tired. She also mentioned something that we have at least heard something about, and that is that if you give a man food, he'll eat it. But if you give him land, he'll grow his own food. And so for us, we believe that if you're able to deal with, if we're able to utilize the resources that exist in city agencies, including land as a resource and water security as resources, I think that we'll put a significant dent in the health issues that exist in the community. And I really appreciate, Councilman Burnett, you framing it as social determinants of health, because it's not just, of course, about how we are well or ill in our bodies, but about how we exist in a larger social environment. And part of that is about, creating the types of environments that we want, being able to define that and actually enacting that. So with that being said, I will, hold space if there are questions, but if you will, I have, if you can, one more. This, for us, it's an image, but what we're looking to do is create community of control. And if we're able to control our food resources and our land resources, I believe then we can put a dent in the health disparities that exist in the city. Thank you.
I agree. So I had a couple questions for you. One, I would just like to sit down as a follow-up to walk through
Sure.
the policy platforms that
Sure.
you and your partners have put together, so I can just learn a little bit more about what you want to see.
Sure.
Isn't an issue area that I've worked on a whole lot of, so I do have some. I won't speak for my colleagues, but I'd say I have a learning curve on this. But I think what you're presenting is incredibly intriguing and something that we do need to sit down and talk. So.
Thank you.
Be following up there.
Okay.
But I did have a couple specifics on the solutions you put forth. One was you mentioned mandates for food and service contracts with city agencies. Can you expound on that piece for us?
Sure. So one of the things, when we talk about sovereignty, we talk about control, right? There are other municipalities and states that have enacted these food sovereignty laws, right? So that really attempt, and Maine is one of those states. I'll have to get back to you on the municipalities, but in order for us to be able to grow the food that we need, either hyperlocally in communities or locally in Baltimore or in surrounding counties, we have to be able to change how food can come into city agencies, including city schools. And so one of the things that I think, of course, there's a lot of, if you will, regulations around what food need to be, the quality of the food. And so shifting those regulations, but also helping folks get ready to get into those agencies. They are about close to 30, somewhere between 25 and 30 farms, and there are hundreds of community gardens in the city. And whether we're talking about producing within city agencies or just feeding folks, and you gave, I think, a really good example of East Africa, West Africa, where there's the idea of folks literally growing from their groves and growing from their gardens or their farms and setting up a table. In Cherry Hill, that's what we do. Twice a month, we're doing that. And so I'm thinking that whether we're able to do that or not, making sure that there aren't barriers to entry in terms of getting into city agencies or acquiring licenses licensing so that folks are able to do that and not run the risk of breaking the law or run the risk of growing food that's not going to people directly. And so those are my thoughts there.
Okay. And we can have a deeper conversation about that. Milk.
Milk. I'm glad you hint. So I think going back to the point that we made in one of the slides about sovereignty, right? Sovereignty is one around being able to control our narrative, being able to define what is healthy for us. My sister stood and said that the list came from CDC, and I recognize that that the CDC and USDA are respected institutions, if you will. However, these institutions represent, if you will, dominant culture, which is white American culture, which to me does not necessarily speak to everybody, even though those are the ways in which we define what is healthy. And just from my personal perspective, because it's like not, it probably would be frowned upon to have human breast milk in a grocery store and call it healthy. It is grotesque to believe that cow's milk would be considered as healthy. I think that something like to the furthering the point that folks needing to be able to define their own food and what exists. If you look at just studies, there are many people of African descent, particularly African Americans, who are lactose intolerant. And so the fact that, and that is a fact, the fact that that would be considered healthy,
Yeah.
that's tough. So that just only adds, I think, adds fodder to my point that we need to define what is healthy for us so that the institutions that either already exist in our community that sell food or retailers that sell food in our community or the ones that need to be developed by the people there should reflect the cultural appropriateness of the people who will be the main shoppers and members of those types of food retailers. So that's just my general thought. Thank you for bringing it.
Oh, yeah. And the last question I had was, trying to find this slide. Okay, here we go. So well, I know for sure a lot of the organizations that are on this slide with your partners are not all in the same area, but is the Black Yield Institute programs, are they all based in Cherry Hill?
Which one? The ones
The
on
slide, this is Black Yield Institute, the programs.
Oh, yeah. So, no, they're not. So, the farm, Cherry Hill Urban Community Garden, and Cherry Hill Food Co-op are two of them that are in Cherry Hill, in South Baltimore specifically. The rest of them are larger citywide efforts. However, we're currently working in our research area, working on using data, mixed methods approach to lifting up what food apartheid looks like on the ground, with the hopes, honestly, of figuring out if we can do a food apartheid study of the city and not just a food environment report, which we believe doesn't necessarily give us all the data and doesn't have all the indicators that really speak to those power dynamics. So that's the hope for us to do ultimately, but those are the two that are in South Baltimore at large, but we work across the board in Baltimore
And
City.
the location of the Farm Alliance, is that citywide?
Farm Alliance is citywide. Some of those folks are, you'll see Black Church Food Security Network, which works
Hebrew Brown,
nationally.
Pastor Hebrew
They work in churches around the city. The Baltimore Gift Economy works in West Baltimore.
my
They're doing some
constituents.
good work. They're doing some good work. They have a farm, but they also have a very interesting farmers market where people, instead of exchanging money, are exchanging points. And so figuring out a co-op model, cooperative economic model. No Boundaries Coalition operates in several neighborhoods in central West Baltimore. Dovecode is in West Baltimore as well. But these are just different organizations that kind of, and I should say Farm Alliance is representative of many, I won't say many, but 20 or so farms, and some of them being, may not agree with, our perspective, and many of them do as well. And I also feel a need to recognize that these are not the only people who operate from that standpoint and may not use Black land and food sovereignty as a frame, but recognize that our issue with food and health and land is one that's very much steeped in issues around race and class, primarily race. But I would lift that up as well.
Understood. That was all I had for you. I want to thank you for coming out and
Thank you.
all that you do. And like I said, we'll be following up to talk about the policy platform piece and see how we can be more helpful.
Thank you.
With that, or is there anyone? I don't see Ms. Daniels. Yeah. I don't think anyone signed to testify.
All right, thank you.
Yep. Thank you, brother. We're good. Okay. All right. So again, I want to thank all of the presenters, most of which had to get back to work, I presume. It is one of the challenges of doing things during the workday. But I think this has been very helpful for the committee. It will be on YouTube. So if folks want to review, watch later, it's available there. This hearing is concluded, and if there's no other business, the committee is now adjourned. Thank you all.